2 more West Australians have with COVID as the state reported a slight dip in new cases, down to 8133 on Friday. The number of people in hospital with COVID remained unchanged at 209, while there was 1 additional admission to intensive care, taking the total to 10. The new men in their 70s and 80s, were both historical and date back to March 22. The small reduction in cases comes after Premier Mark McGowan on Thursday announced Level 2 restrictions would be largely stepped down from March 31, with health authorities expecting the peak had already arrived or would be reached in the coming days. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. Around 1,900 public healthcare workers are currently furloughed as a result of COVID protocols, but lower than expected hospitalizations mean some non-urgent elective surgery could return as early as next week. Speaking on Talkback Radio on Friday, Health Minister Amber Jade Sanderson revealed the government was considering revising a pause on booking new non-urgent Category 2 and 3 elective surgeries that has been in place at public hospitals since March 14. While cumulative COVID cases have been higher than forecast by Omicron modelling prepared by WA Health, the number of patients both in general wards and intensive care remains well below predict levels. Camera icon Health Minister Amber Jade Sanderson revealed the government was considering revising a pause on booking new non-urgent Category 2 and 3 elective surgeries. Kelsey Reid of the West Australian. That prompted a ban on booking new non-urgent elective surgery at private hospitals to be lifted on Wednesday, after it had been in place for just 2 days. As far as the state system goes, I do want to just reiterate the point: there are 1,900 staff furloughed in the public health system, Ms. Sanderson told Talkback Radio on Friday. We are looking at what Category 3 surgeries we may be able to bring back online perhaps next week if our numbers continue to stay low. But the priority right now is replacing those furloughed staff, and at the moment, the elective surgery ban for Category 3 non-urgent surgery is appropriate to be able to support the absenteeism that we're seeing due to COVID. Just shy of 18,000 PCR tests were conducted on Thursday, in line with recent days, with 3,653 returned a positive result. The remaining 4,480 cases were self-reported following rapid antigen tests. There are now 45,306 active cases in WA, the majority in the metropolitan. Active infections now exceed 1,000 in both the Southwest and Pilbara. They are followed by the Great Southern, Goldfields, Kimberley, Wheatbelt and Midwest.